Addiction is a chronic but treatable medical condition. Often unintentionally, many people still talk about addiction in ways that are stigmatizing, meaning they use words that can portray someone with a substance use disorder, SUD, in a shameful or negative way and may prevent them from seeking treatment. With simple changes in language, harmful stigma and negatively around SUD can be reduced or avoided. Let's discuss more to learn about what stigma is, how it affects people with SUD, and how you can help make a change. Stigma is a discrimination against an identifiable group of people, a place, or a nation. Stigma about people with substance abuse disorders might include inaccurate or unfounded thoughts like they're dangerous, incapable of managing treatment, or at fault for their condition. Stigma around addiction may come from old and inaccurate ideas or fear of things that are different or misunderstood. Today we know that addiction is a chronic, treatable medical condition. We also know that people can recover and continue to lead healthy lives. The feeling stigmatized can make people with SUD less willing to seek treatment. The negative stereotypes about people with SUD can make others feel pity, fear, and even anger. When talking to or about people with SUD, make sure to use words that aren't stigmatizing. Let's discuss some helpful tips for getting started. Use a person-first language which focuses on the person, not their illness. It focuses on removing words that define a person by their condition or have negative meaning. For example, persons with substance use disorder has a neutral tone and separates the person from his or her disorder. Let people choose how they are described. If you're not sure what words to use, just ask. Check in with friends or loved ones about how they refer to themselves and how they would like others to refer to them. Use instead of, because, person with substance use disorder. The person with an opiate use disorder, OUD, or person with opiate addiction. Addict, user, substance or drug abuser, junkie, using person. First language shows that SUD is an illness. Using these words shows that a person with an SUD has a problem, illness, rather than is the problem. The term to avoid illicit negative associates, punitive attitudes, and individual blame. Person with alcohol use disorder. Person who misuses alcohol, engages in unhealthy, hazardous alcohol use, alcoholic, drunk. Person in recovery or long-term recovery, person who previously used drugs, former addict, reformed addict, testing positive on a drug screen, dirty, failing a drug test. Use medically accurate terminology the same way it would be used for other medical conditions. These terms may decrease a person's sense of hope and self-efficacy for change. Use instead of because. Substance use disorders, drug addiction, habits. Habit implies that a person is choosing to use substances or can choose to stop. This implication is inaccurate. Describing SUD as a habit makes the illness seem less serious than it is. Use for illicit drug use, misuse for prescription medication used other than prescribed. Abuse. The term abuse was found to have a high association with negative judgments and punishment. Use outside of the parameters of how medications were prescribed is misuse. Use instead of because. Medication treatment for OUD. Medications for OUD, opiate agonist therapy. Pharmacotherapy, medication for a substance use disorder. Opiate substitution. Replacement therapy, medication assisted treatment. It's a misconception that medications merely substitute one drug or one addiction for another. The term MAT implies that medication should have a supplemental or temporary role in treatment. Using MALs aligns with the way other psychiatric medications are understood, such as antidepressants and antipsychotics, as critical tools that are central to patients' treatment plan. Being in remission or recovery, abstinent from drugs, not drinking or taking drugs, testing negative on a drug test, clean, use of medical terminology the same way you would for other illnesses can help reduce stigma. Use instead of because. Baby born to a parent who used drugs while pregnant. Baby with signs of withdrawal from prenatal drug exposure. Newborn exposed to substances. Baby with neonatal abstinence syndrome.